Hello, welcome to Deep Rooted Niger, Baby, Texas. I am your host, Ogechi Duru, and I'm here today to talk about aging with grace, the importance of aging with grace. I am so glad to have you listen to this episode and be part of this wonderful conversation, the podcast where we delve into profound conversations, captivating stories, and genuine growth that inspire bold living and intentional growth. Discussion about aging and also exploring geriatric health and how to support aging parents and loved ones with dignity and respect. I'm thrilled to have an amazing guest on today's episode, Dr. Abo. So I'm happy to have him be part of this discussion. So who is Dr. Abo? Dr. Abo has been in the healthcare industry for over 30 years. He attended medical school at University of Benin College of Medicine and completed his residency at the University of Maryland Medical Center in Baltimore, Maryland. With his partners, he manages a medical facility called Mace Medical. His practice is in Maryland. They are committed to continuing to provide greater access to healthcare and higher quality care to their patients. His primary care interest is centered around geriatrics, diabetes, nephrology. I know it has to do with kidneys. Let's dig into it. Dr. Abel, welcome. We're happy to have you.
Thank you, Ogechi, for having me. You did good.
I am grateful that he has the time to dedicate to this topic that I know impacts a number of different people at different stages of our lives. I know a lot of friends and family who have aging parents, so I know this will be a valuable conversation to a number of people. So again, thanks, Dr. Abo. So let's get into it. Dr. Abo, could you tell us a bit about yourself? What drew you to medicine? And also, what's a common myth about aging that you would like for us to debunk? Also, explain the meaning of your name.
My full name is Chukwumalenkem, which really is a statement as to one's destiny in life. So it really means that God knows what is mine. That's really the full meaning of my name. When you ask about my personal journey and career, um, that it's interesting. I think it's cliche to have most folks say, geez, I wanted to be a doctor. I got drawn into medicine because of some experience at a younger age. Honestly, that wasn't my case. I never wanted to be a doctor. I actually wanted to be more like an engineer.
Wow.
Yeah, or like an architect. What drew me to medicine really was my late dad. He had wanted to be a doctor, and he cooked up the perfect plan to get me to be a doctor by having me spend a summer with my uncle, his younger brother, who was a doctor, an anesthesiologist for Shell, which is a big oil company in Nigeria. And during that summer internship, while I was in secondary school in Nigeria, I literally got to see a lot, I'd say really pump and a lot of fancy stuff, living with a doctor at Shell Camp in Warri, going to the club every evening, playing golf, tennis, getting on a helicopter to fly out to oil rigs or to remote areas with him to care for persons who had a need. I was drawn really by the pump, but beneath that was I'd say, so really for me it was that fateful summer that made me say, you know what, I'd like to be like my uncle and be a physician and light up the room by providing care to folks, while at the same time having fun doing it. And nothing beats getting a young boy to want to do something than a first helicopter ride. So that was
Wow.
it for me.
With the number of years that I know you have, I've never heard this story. So this is really cool to hear that just mentorship and spending time with an uncle changed your trajectory of where you wanted to go and to where you are today. That's amazing.
Yeah. It really is. For me, it speaks to what has truly been my life's calling, which is teaching and mentoring others. Because, yes, really can make a difference by sharing knowledge.
Okay. So, in a nutshell, you grew up in Nigeria. You went to medical school in Nigeria and then came to the US and did your residency in Baltimore, Maryland. You have your own practice, right? Which is called Mace Medical.
Yes.
So, what would you say the common myth about aging is that you would like to debunk?
I think the misunderstanding for most folks about aging is like a resignation that it's inevitable.
Wow.
Yeah. So you kind of resign to, I'm going to get old without understanding that it's all within your grasp to plan and prepare for it.
Well said. So, what is geriatric health then? What would you define geriatric health?
It's simply speaking, geriatrics, geriatrics, also known in some circles as gerontology, is the practice of caring for older adults. If you pay attention, I use the term older adults. Yes. So it's usually folks older than 65 years old in the United States. That definition of who is an older adult actually changes depending on the society you live in, the country you live in, and the community you serve.
So just similar to the fact that you have doctors who are focused on children, you also have doctors who, I'm just trying to simplify things for people, where you have, I think they're called pediatricians who take care of babies up to a certain age. Then you also have doctors who take care of adults, older adults.
Yes. So that is the exact classification of that subspecialty. So geriatrics is a subspecialty of internal medicine. Just like you have cardiology, just like you have nephrology, you have endocrinology, you have gastroenterology, you have pulmonology, and these are all subspecialties of internal medicine. That is how you also have a subspecialty of internal medicine called geriatrics. Yes.
So let's start unpacking the physical and cognitive changes that come with aging. What do you typically advise families to expect or individuals to expect that are or that could signify that there are some deeper issues that they need to address?
So, I would like to step back to highlight that the study of aging is actually, and it's really fascinating to say this, but the study of aging, you'll be surprised, is something that is pretty new.
Wow.
We haven't really paid much attention to aging. I think as a society, we're resigned to it. We just accept it, or we're gonna get old. So I was fortunate to train here in Baltimore and also practice in Baltimore. And Baltimore can be regarded as the mecca of the study of aging. The National Institute of Aging, which is a division of the National Institute of Health, is barely, I'd say, less than 5 miles from my practice. And the study of aging actually started here in Baltimore in 1958.
Wow.
There's a study that is still going on. So you can imagine how much knowledge has been garnered from that study. It's called the BLSA, the Baltimore Longitudinal Study of Aging. It started in 1958 in Baltimore and it's still ongoing. And another fascinating point is that study only accepted females in 1978. So you can actually say that the study of aging in women, to the best of my knowledge, uh, is not even up to 50 years.
Wow. So overall, the entire studying of aging has really gone on. If I do my math right, it's about 68 years old. And so, but even to the point that you just made, the focus around women is not even probably up to 50 years old at
Yes.
this point.
So
which explains a lot as to some of the conversations we hear going on today about women and health, especially aging women.
Yes, yes. So, I don't know. Again, we were resigned, lots of assumptions, oh, I'm going to get old. So, there's nothing I can do about it. But we've learned over the years that there's a lot that you can do to prepare yourself for that. So, if you think about it, someone born in 1958 is, to your point, is 68 years old now. So, that person just became a geriatric patient 3 years ago. And a woman born in 1978 is not yet a geriatric patient. That, in a nutshell, tells you how young the study of aging is and how much more we have to learn.
So, based on what you know today and based on your training, right, and your experience, what do we consider normal versus abnormal aging? And I may not be using the right terms, right?
I think you're doing well,
Very
and,
good.
and I think you're doing well, and because again, I think back to resignation as to the process of aging, we tend to be hyper focused on memory, and we think aging is all about memory. And at some point, I would I would try to clarify, what normal aging with regards to memory looks like
Hmm.
versus what abnormal age in regards to memory looks like. But there's more to aging than memory. In geriatrics, we use we call it the 4 M's. And number one is mobility. Number one is mobility. So we're hyper focused on how well our how our patients can ambulate, can get from point A to point B safely. And it's number one because we know, based on studies, that if an older person has a fall with injury, like a fracture, most of them will not live past 1 year after that fall with injury.
Wow.
So that's why it's number one to us. Second is memory. Third is medications.
Okay.
We know that taking multiple medications, what we call polypharmacy, all the patients is more detrimental than it is advantageous. And the last M of the 4 M's is really what I think is the most important. No, I would say the most important is what I think is the one that's more personal to the patient. And we call it what matters to you,
Mm.
because we all need to have a reason to want to live. We all need to have a motivation. So, for some folks, it could be family, it could be their grandkids, for some folks, it could be community, for some folks, it could be their faith, and their belief system,
So
but
basically, what keeps them going at the
that's
end?
it. That's
Yeah.
it. Because it's that stuff that keeps you going that will make you
Live as long as possible.
not just live, but live a quality life,
Life.
quality life, where and you put in the work and you're not just resigned to say, "Oh, yeah, I'm going to get old." No, but you know what matters, right? So
Yeah.
you work towards it. You have a goal. Yes.
As to what keeps you going. So, what I'm hearing from you in general is that aging in general is really your overall health, right? And
Yes.
then knowing the fact that the research around aging is still fairly young in itself, right? So we're still learning, we're still trying to understand it.
Mhm.
And then the things that physicians like yourself typically look at is the fact that what's their mobility like? What's their memory like? What's their medication like? And then what matters to them, right?
Yes.
Looking at that, all those things holistically to be able to help care for your patients who are aging in general.
Yeah. Not just so it's not only about the physician caring for the patient. It's about
Uh-huh.
the patient
Caring for
caring
themselves,
for themselves and the family and caregivers.
caring for them.
Yes, knowing what to be focused on, So I can take mobility, for example. We know that as you get older, you don't gain muscle mass.
Okay.
So we strive to encourage, our patients to stay active, lift weights, and it doesn't have to be, like weights in the gym. It could just be your body weights, body weight exercises, isometric exercises. And we know that any of those exercises, squats, standing up from a chair without pushing up, we know that those exercises that strengthen and condition your muscle, if done consistently over time, would lead to increased mobility as you get older.
Okay.
And with increased mobility would lead to less dependence on others to get from point A to point B.
In general, things to consider or to look at from an aging perspective is their mobility, their balance, their muscle strength, right? Their cognitive health, making sure that they're also having routine screenings and stuff because it's the entire body, your vision, your hearing, managing or limiting risk for
Yeah.
falls. Because, like you said earlier, if somebody's mobility is not great or they have a mobility issue due to a fall, then there's a possibility that the longevity for them could be a year or so. So being able to manage those things
Yeah.
from an aging perspective and looking at those things as to when there are differences to be
Mhm.
able to then consult with their doctor
Yes.
as yourself. Okay.
Yes. So, talking about having this holistic approach
Mm-hmm.
and talking about what matters,
Mm-hmm.
pick one particular aspect. What matters, So what matters to someone who might be they're looking forward to their granddaughter's wedding, or they're looking forward to, you know, their grandson's graduation from nursery school. What matters, right? What matters, to them, as I've stated, there are these two events, but to enjoy these events, they would need to have good hearing and good vision. So that brings it to, okay, just don't be resigned to the fact that, oh, I'm going to get old and my vision is going to become poor, or I'm going to get old and my hair is going to become poor. Huh? There are very simple causes of decreased hearing in the elderly that can be easily fixed, as simple as the eardrums being impacted with wax. And we just need to clean it up. And yes, some do have hearing loss and might need a hearing aid. And that investment in that hearing aid would greatly enhance their quality of
Yep.
life
Yeah.
and the ability to enjoy what matters. Same thing with vision. That's why vision screening and hearing screening are important parts of a wellness visit for an older adult. So, you want to pay attention to decreased vision, which again could be more complicated, but also could be as simple as a cataract surgery, which is a few minutes under the knife in an outpatient setting. You go home and it's like literally night and day after. So that's why it's important to have your wellness visits and have this screening test done so that if any loss of these senses is observed, they can be addressed quickly in a timely
Mm-hmm.
manner, because we know that when these issues are addressed, what matters to you is accomplished, keeps you wanting to live more and more and more. We work harder and harder and harder to be in better health. Yes.
So I'm hearing multiple things from you. One is being able to maintain or manage your health from your youth all the way to when you get to the point where you're aging. That's one thing. And that's where your routine screenings come into play from that perspective. But the other aspect of it is that even when you're aging, there are some things that you may go through, like you mentioned with the hearing issue, where they may just need to just clean the ears out because there's been a buildup of wax in the ear, or with the eyesight, whether it be cataract surgery or whatever the case might be. But some of them could just be basic things. If you maintain things over the years and you go through those routine screenings as you're aging, it helps. Granted, there are other factors that could play in every aspect of life. But
Hmm.
as long as you're doing those basic things, but most importantly, you also have that willingness to live. You have that community. So you also touched on, that quality of life. So what are those things that keep you going that you need to continue to do during that aging process, whether it's value in hobbies, activities, your family, having that autonomy in your life to be able to move around. Again, where those 4 M's come into play from a mobility perspective, your memory, your medication, and what matters to you. These things helps promote that quality of life that you need to have as you're aging. And that also includes nutrition and everything else, right?
Yes.
But at least the promoting of quality of life is very important for us to also maintain. I think what I keep hearing you say, knowing what it is you're living for and making sure that you're also taking care of yourself through that process as you're going through that aging experience.
Yes, yes, yes. And there's, there are other factors, like you said. And I'll bring us back now to, the elephant in the room, which is memory. And like I said, that's what most folks seem to be hyper focused on. But there's normal aging, and how I try to simplify it for most of my um, patients is I use the word forgetfulness. I don't like to use
Alzheimer,
memory
memory
loss.
loss, and all
Memory
that.
loss.
Yeah, those big words.
Yes, I don't like to use big words. I just say forgetfulness. So forgetfulness is normal. Age-related forgetfulness is normal. Dementia is not. I break it down for them in a very simple manner. So when we talk about the memory, I tell them that if you forget which day it is and remember it later, if you forget someone's name or word you want to use or a name you want to call and remember it later, if you forget where you place something and remember it later, that's all normal aging. That's just age related forgetfulness. Dementia, the big elephant in the room, um, is more of a decline or a loss in what we call cognition. Yeah. Which is really the ability to think, learn, or remember. So it's not all about remembering now, right? Ability to think, to problem solve, is the ability to learn something new. If I have a patient who is an older adult and they're worried to death that they have dementia and they tell me that they just started playing pickleball and they learned the rules and they're doing well at it, I just tell them you don't have dementia. Because if you had dementia, you would not be able to learn
Something new.
anything new, period. They tell me, oh, geez, I just learned this new game. So I tell them, no, you don't have dementia. You have age-related forgetfulness, which is age appropriate. So it's important that we make this distinction.
I agree.
It is when there's a loss of this brain functions, the loss of the ability to think. So a loss of a brain function of thinking, of remembering, of reasoning. It is when these brain functions are lost and they decline to the point where it interferes with your daily life, your daily functions. That is when uh, uh, dementia exists, and that's when we have a problem with the called memory.
Those are things family members need to pay attention to. Get in front of a doctor to talk about, figure out what the next steps are.
That's when they need to take their loved one to get evaluated
Please.
by a competent physician. Because interestingly, the third M, so I'm taking us through, the 4 M's.
uh,
The third M,
Medication,
medications, can actually lead or contribute to a loss of brain function that might mimic
dementia,
dementia.
but it's not.
There's some medicines, especially, and I'll paint a picture. There's some medicines, especially in older adults, both sexes. A very common medication. They take medications to try to address symptoms of urinary incontinence or bladder incontinence or overactive bladder. Those medications are called anticholinergics, and those medications do, as a side effect, cause a decline in memory.
Okay. For some patients.
For some patients, that mimics dementia, but is not dementia. So when these patients come to us, one of the first things we do in geriatrics is to do a complete reconciliation of their medications, address polypharmacy if we think it exists. We get a complete list of all the medicines they take, including over-the-counter medicines, because they're over-the-counter medicines that also mimic these anticholinergics.
Important to tell your doctors what medicine.
We want to know, what
What
are you
medicines you're
taking?
taking, not the
What are
only
you
the ones
taking?
that's prescribed, but also
No,
the
what are
ones
you taking?
over the
What
counter.
supplements are
Yeah.
you taking? Yes. We've had, in my experience, I've had patients who are brought by their family due to concerns of possible memory issues. And just by stopping certain medications, they're back to their baseline and back to normal. So it's very important that we pay attention to that aspect too. Yes.
That's very good insight. So let's talk about quality over quantity of health, because I know this can be a topic on its own that we can delve into. But from an overview perspective, what are some of the things that you want to get people to really understand around the balance of quality of health versus quantity of health when it comes to aging and making healthcare decisions?
Okay, Chi, you're right. This can be a separate topic that would, take our time, and we will not even get to the bottom of it. And that's because there's a lot to unpack when you talk about quality over quantity. There are a lot of variables driven by personal factors, societal factors, and socioeconomic factors too. To sum it up, we want to live a full and rich life. And when we talk about what matters, so we're now in the four M's. My goal as a geriatrician is to help older adults maintain their functional and personal goals. I'm not trying to get you to achieve mine, functional and personal goals. I want to help you reach the goals you set for yourself. I want to help you maintain and achieve those functional and personal goals you set for yourself. And, you know, everyone is different. I will, at this point, like to point out, since the name of your podcast is Niger Babe in Texas,
Yes.
I'll now say something particularly about Nigeria, you know, um, and I'll bring it home with regards to what matters and quality over quantity. I shared very early in today's discussion that the study of aging was still young, literally speaking. But I have to proudly say that a landmark study that was done by the University College Hospital, that's University of Ibadan Medical School, called the Ibadan Study of Aging, ISA. Um, I believe was done in the early 2000s. Um, it was another longitudinal study, so done over the years with reports coming in 2007 and 2011, showed that in the Yoruba speaking population uh, in Ibadan, that their what matters was severely impacted. Their ability to function, was severely impacted by depression, which came. I won't say it came to me as a shock, but given our societal peculiarities, was surprising, and it showed that what affected their ability to function the most as they got older, leading to poor functioning in social aspects, social isolation at work and at home, and an impaired quality of life was depression. Actually, in that study, Ogechi, one in four persons.
Wow,
So
that's a lot.
yes, one in four persons. I believe it was about 26%, had a lifetime risk of major depressive disorder. And it was seen leading to social isolation. It was seen mostly in women, and it was seen mostly in folks with a lower economic status and folks with chronic pain, primarily driven by arthritis. When you take what I just stated, put it next to quality versus quantity, it becomes obvious that whatever I, as a clinician, can do, whatever the patient, because they're primarily responsible for their own health, can do, and whatever the caregivers can do, to promote their ability to attain their functional and personal goals will eventually lead to quality over quantity. That brings me to something I believe in a lot. I believe in a lot that, and it's been one of the driving initiatives from the National Institute of Health, National Institute of Aging, which is based in East Baltimore at Johns Hopkins Bayview Medical Center. It's a program called Aging in Place, growing older at home. We've been able to figure out that if we want folks to have quality over quantity, we have to do all we can to make it possible that our older adults can live in their home and communities safely and independent as they get older.
Now, what's that definition of home, too?
Home, really, that's a very, very pointed question. Home is defined in many ways, but I'll be very blunt, okay, Chief. For me, home is where your heart is. So home, I don't want it to be mistaken as a house.
Exactly.
So it's not a physical place, So home is really literally where your heart is. So home could be with family. Home could be by yourself. Home could be, given our culture, speaking specifically to Nigerian folks. Home could be with your kids because we going to have dwellings, houses, homes where multiple generations live in the same home. When I talk about aging at home or aging in place or growing old at home, I'm not necessarily speaking to your home and I think if the older adults remind themselves, what's the goal? The goal here is for you to be safe and independent.
Yeah.
And if that is best achieved with your family, that's your best situation. If that's best achieved with you in your own home by yourself, that is good. If it means moving in with siblings or friends, that's also good. Literally, home is where your heart is, in my opinion.
And some other things that I know you and I have talked about, but we just want to at least highlight some important things that are critical for people to know about. First of all, knowing you have to have a plan. What does aging look like when you say aging in place? There needs to be a plan around what that aging experience needs to look like. Also, having a plan as to your end of life preparation, or what is also called as an advance directive, as to how you want your care to be handled when you're aging.
Yes.
Or in difficult situations. What does that performance status look like? I know, especially if you've been impacted by a fall and things of that nature, how does that health care look like? How does that individual also, because you've used the term with me called use it or lose it, that impacts their ability to ensure that they're staying active. If we've not been active all of our years, you cannot expect to be active in your old age.
Yeah. So most folks don't want to talk about end of life. So I tend not to use that term. What I tend to suggest is let's plan for your care in advance.
In
So we
advance.
call it
I like that.
advanced care planning. Let's plan for your care now that you're in a position to state clearly what your wishes are. So that could include selecting someone to make medical decisions on your behalf when you're unable to do so yourself. So we call that a healthcare agent. And that could also include, but doesn't have to, but could also include you spelling out what your living will is. What's your will to live in certain conditions? Like if you have end stage disease or terminal disease, or
Mhm.
you know, you are in a persistent vegetative state, what is your will to live? Would you want everything done to keep you alive, or would you want to be kept comfortable and allow natural death to proceed or occur? Because we're all gonna die, even though we don't want to talk about end of life. But these discussions are important so that we can, again, like I said, be more proactive in our approach to aging, so that we take charge of it and we can be in a position to say, okay, I know I'm going to get old, and I know that I'm going to, depending on since I have needs help. I might need help in some,
Long-term care facilities or with the caregiver
yeah,
or
yeah.
whatever the case might be.
I wouldn't even say it like in the long-term care facility. I might just need help to perform like basic
Duties.
activities of daily living. I might need help with that. I might need help to perform some IADLs, which are a little bit more involved. I might need to understand clearly, uh, my overall state of health. If I'm
Mhm.
one who is, bed bound and barely able to get out of my bed, and I cannot sit up, I cannot transfer out of my bed, I cannot walk, then what's the quality of that life versus if I'm someone who is able to, groom myself, bathe myself, toilet myself, feed myself. Um, so these are, it seems like a lot, but these are all the things we have to consider, engage in care planning in advance. So that's what we call advanced care planning. I tell my patients this: there's no right or wrong, especially if you're the one making the decisions, because it's for you to determine what would you like your later years to look like. And if you're able to, in my opinion, share it verbally and
Mhm.
or put it in writing with your loved ones and caregivers, it makes everybody's life a lot easier.
Very well said. Very well said. So just being proactive, basically, is one thing to write a will. I mean, even within our own culture or with Nigerians in general, nobody wants to talk about death. Nobody wants to talk about writing wills. With your health, it's just as important to be able to have a plan, not just thinking about when you pass on, but even when you're still here, because we know people are living a lot longer these days. But
Mhm.
while you're aging, do you have a plan for that aging process? And then take some steps back. This is more to my younger folks, being able to be proactive in preparing for that old age by taking care of yourself in your younger years so you don't get to a point where, yes, there's genetics and everything else, but what can you do to be proactive as much as possible in trying to make sure that when you're aging without possibly health issues. And so that's why the reason for
You're
these
aging, you're aging,
conversations.
yeah.
Yeah,
You're aging gracefully. You know,
exactly.
so I don't engage. So you use the word here that, and I'm glad you did. I've not throughout our time together here talked about a will, and honestly, I tell my patients I'm not interested in
Hmm.
finding out if you have a will or not. I'm not saying you shouldn't, but that has nothing to do with your health care. That has nothing to do with your advanced care planning.
Exactly.
Yeah, what I'm rather focused on is how can I, as a geriatrician, help you maintain? Again, it's your personal goals. It's not mine. It's your functional goals. It's not mine.
Hmm.
You know, how can I help you maintain them, and how can we collectively plan for your care in advance so that as your overall health declines, which is part of aging, how do we have the resources in place of your choosing? Huh? which we understand are limited by,
So many
so
factors.
many factors. Yes. Support system, your financial resources, we get it, right? Who is better positioned to know, what you can afford for how long and what your preferences are than you
You.
yourself. Yes.
In order to give you that quality of life.
Yes, yes,
Yes.
yes, yes, yes. As you get older,
I am in awe, for lack of a better word. And I'm happy I'm having this discussion with you. And I know why it was an important topic for me to be able to have the discussion about, because we don't talk a lot about this aging in general, and we don't talk about what it means, how important it is, and how to prepare for it, right? And so I'm in awe at the fact that there is really so much to talk about that we've really barely scratched the surface.
true. Yeah.
On this discussion, right? I am grateful that we've even had the opportunity to at least talk about some poignant things that we can possibly expand on later. But at the end of the day, providing people with some really valuable information. So in general, we've talked about the 4 M's, what's really important during aging: mobility, memory, meditation, and what matters to you. We've talked about research. It's your health at the end of the day. So
Yes.
you need to have an understanding of how to manage that health by being proactive during your youth. And I'm saying this also for my younger folks from an age demographics perspective, but also for those who are in their aging process, keeping up with your exams, right? And all of those things that are important to maintaining that health, and knowing that it's your overall health. It's your vision, is your hearing, is your ability to walk. All those things are critical. And then how to prevent diseases, right? That's why we have to do our breast exams for women, for example, men, prostate exams, all those things. They're really, really critical for us to be able to not just be proactive, but also to maintain our aging process. And then lastly, being able to have a plan long term as to how to manage that health where you have that quality of life versus just quantity of life, and understanding the importance of really having that to ensure that you have a life that, even though your mobility might not be strong, but you're still living in an environment where you're thriving. And what does home look like to you was also another important or valuable discussion. So I think overall, all these things really help in getting people to start thinking about what aging should look like, what my aging should look like, what their aging should look like, as well as what can they do to maintain it, and knowing that they have doctors like you that can support them through that process.
Yes, no, thank you, Ogechi, for this opportunity. During a recent trip to England, I watched something on BBC, a program called The New Normal with Kathy May, and it talked about it was literally, it was a flip. It talked about grandparents glued to their phones and families are worried. And the question was asked, should kids be worried that they're older adults, like grandmas and grandpas, are spending so much screen time? It brings me back to what I'd like to end this, wonderful time with you, uh, with is, we just have to find a way to stay active and engaged and avoid social isolation.
Yes.
We have to, be active physically and mentally, emotionally and spiritually. We have to, as human beings, we are social animals. And I tell my patients all the time, if you don't lose it, you lose it. So we just have to try as much as possible to, use every fiber, every being of our existence to make it matter as we get older.
Yes. So again, I want to say thank you, Dr. Ebo Chukwuma. What's that last part?
Chuku Malinkem.
Chukuma Inkem. I didn't even
Malin.
know that. I didn't even know that. I've just been calling you Chukuma, not knowing that there's an additional part to the name that
Yeah.
is extremely powerful. But again, thank you, Dr. Abel, for this time. Thank you for the conversation. I know it's going to make an impact to people, and there's a lot of wisdom and insights that you shared. I really just want to say thank you again for the time that you've dedicated to this discussion. For those of you who are in the Maryland area, his practice is called Mace Medical. They have a couple of locations. There is in Essex and Dundalk, Maryland. You can reach them at macemedical.com. They're also on Instagram under the handle mace_medical. Again, thanks for tuning in to Deep Roots with Niger Babe in Texas. If today's episode resonated with you, please share it with somebody and subscribe to hear about our next episode. And until next time, keep growing and keep aging gracefully.
Thank you.
Thank you.
I enjoyed this tremendously. Thank you.
Thank you.